Welcome back to the Progressive Rehab and Strength Podcast. I'm your host, Dr. Rory Alter, here with my lovely co-host, Dr. Eliza Havison. We're both clinical coaches here at Progressive Rehab and Strength, and we are back for our first podcast recording of 2023. So this is super exciting. We recorded a bunch in 2022 just to kind of get us through January, and here we are recording some new podcasts for you. So we're going to start with a 10-minute tip Tuesday. So if you're listening to this when it airs, it's Tuesday. Happy Tuesday, everyone. And in these 10-minute tips, we just, set a timer for 10 minutes. We talk about a topic or question that you guys have, a common questions that you guys have, or common experiences that you have in powerlifting, barbell training, and injuries and progress and all those things. So in today's 10-minute tip, we're going to be talking about modifying the squat for knee pain. So we're going to set a timer for 10 minutes and we're going to talk about knee pain in the squat and what you can do about it. All right, here we go. You ready, Alyssa? Setting the timer. 3, 2, 1, go. Okay, Alyssa, why do the knees hurt when we squat?
Usually it's not the knees, but typically when we see knee pain during the squat, it's related to the knee angle and how the knee is moving. And I always like to say that the knee is often not the culprit of what's going on. Knees probably aren't as quote unquote, as a lot of people say, bad. But we have to look at the position of the knee throughout the range of motion and how the joints in the knee are moving while someone is squatting. So, Rory, I'll let you kind of go into what things are going to affect knee angle and movement. But those are like the two big pieces of it.
Yeah, I think that's a really important part of knee pain in the squat. And I think that you kind of touched on it when you said it's not the knees that are hurting. And to be fair there, like obviously if you're experiencing knee pain, you connect the experience of pain to the knee, but like Alyssa said, like you said, it's really about how we're moving and how our movement is affecting the knee. And we've had multiple podcasts on pain in barbell training and the pain experience and all that stuff. So again, it's not ever just technique and it's not ever just how you're moving. It's a combination of your own pain experiences and beliefs around pain in combination with whatever might be going on at the physiological or biological level in the knee, possibly, and also how we're moving. So technique and our program, or the stress on the joint from our program and our recovery and our volume intensity and all those things. So it's all these things combined. But in this 10-minute tip, what we're going to be talking about is technical components of the squat that affect the experience of knee pain in the squat. And when you said it's not usually the knee, it's our movement and how we're moving through space to position the knee joint, plus all the muscles, ligaments and tendons and joint structures, how they're being moved and affected by movement and load throughout the motion. And so typically, anterior knee pain, or anterior knee pain, or medial or lateral anterior knee pain, is going to be affected most by having a deeper knee angle, so a more acute knee angle. And that's because that when we get that angle, it's our knee is sliding more forward. Our thigh and our thigh and our calf are approximating closer. So it's just more stress and more closure on the knee. And that can stretch the anterior structures of the knee. So the quadricep muscle, the ligaments, and all that stuff, and the joint capsule, and put pressure on the front of the knee. And that can cause some knee pain. And then the deeper we go, or the deeper the knee angle is, it can also put compression on the posterior aspect of the joint, or inside the joint as well. So what we want to talk about is modifying the squat to open the knee angle a little bit more, so we're not causing as much pressure over time accumulated with our training stress. So again, it's not simply that the knee position, it's the knee position under stress accumulated over time in our training, right?
Yeah, and just to be completely clear with everything that we're talking about, because I know that there are some ideas out there that knees moving forward or knees being past your toes is bad, or squatting below parallel is bad. Like, these things aren't bad for your knees. We have to look at the type of squat that we're doing and
Mhm.
how someone is moving. So,
And what you're experiencing,
yeah.
because you could be in these positions and have zero symptoms ever. And then how can we say it's bad if you're not having any symptoms or if you're not experiencing any dysfunction or pain or whatever? So again, it's just what you're experiencing accumulated over time between your training stress and your training technique and your recoverability. So, Alyssa, how do we, in what scenarios might we have a more acute knee angle, and how do we open that up so that someone isn't getting as much tension or pressure or compression in their knee?
Yeah, so we tend to see more of an acute knee angle when somebody is squatting really deep or shifting forward
Mhm.
into their toes in the bottom of the squat. I mean, I think that's a big one, and that's where, and we see this a lot. The shift forward, maybe the heels pop up a little bit in the bottom, and sometimes when we see that, the depth is lower than it needs to be. And when we say too deep, it's also a loss of tension in the bottom.
Mhm.
Um, and, I think that the most common thing that I see happen when someone's trying to address that is they shift back into their heels uh, really early in the squat. And
Mhm.
and then we run into the problem of the fact that, we're our bodies are going to overcorrect for that, and then we end up shifting forward in the bottom. So that's one of the first things that I will see happen. And sometimes, even if they're not trying to correct for that, they're doing it anyway, and it leads to that shifting forward, um, and potential loss of tension in the bottom as that happens. So, I mean, really, the way that we can address that is by keeping the weight distributed over the midfoot
Mhm.
throughout the full range of motion. So, and if you need to think of it as pressing your toes and your heels down into the
Mhm.
ground to
Mhm.
keep both of them planted and driving, um, that can be helpful. But doing that through, like, at the start of the rep and into the bottom
Mhm.
and as you
The
drive back
whole,
up.
yeah, I think that, a lot of people only think about things at the start of the rep.
Hmm.
But when we're correcting things, or I shouldn't say correcting, when we're addressing things to change our technique, we have to think about it constantly. There was something, so one thing that I think is really helpful for addressing knee pain in the squat is taking a video of your squat from the side, because you can get a lot of, especially for anterior knee pain, you can get a lot of information from what's going on from the side view. You'll be able to see how low you're going. You'll be able to see how far your knees are shifting forward. You'll be able to see what that knee angle looks like at the bottom of the squat, or the position through in the squat where your knee is hurting. You'll be able to see what that knee looks like from there. You'll also be able to see, do your heels stay in contact with the floor the whole time. But just to kind of address the depth thing with, in terms of knee pain, so the lower you go, the greater the knee angle is going to be, and likely the more forward the knee angle is going to be, the more forward the knee is going to be. So some things that you'll see with knee pain is that the heel pops up and that the squats are too low. So if you're looking, and that also, this causes this shift forward, right? So if you're looking at it from the squat, or from the squat, from the side, what you might want to think about is, one, not going too low, because that'll address any knee slide that happens past proper depth, which is the hip crease coming just below the top of the kneecap. That will oftentimes resolve the issue of the knees sliding too far forward and the heels popping up. But if you're still seeing that your heels are popping up, you can think about pushing into your heels and feeling your heels touching the ground the whole time. And this is something that you actively have to think about. There's not going to be an exercise that we're going to recommend that you do to fix your heels popping up. There's not going to be an exercise that we're going to default to first to fix knee slide. We're going to default to using our brain first, before anything else. But so two other things that I wanted to mention in terms of anterior knee pain in the squat is bar position. So if your bar position and torso position, which also kind of ties into eye gaze. So the more the higher your bar is, the more upright your torso position is going to be if you're balancing the bar over the middle of the foot. And the more upright your torso is going to be, the more acute your knee angle is going to be, because your knee is going to be, you're going to go a little bit lower. There's going to be more pressure on, there's going to be more shift towards the knee, and in that position. So, the most pressure on the knee, or the most, the most pressure on the knee, the largest angle, the most acute angle is going to be the front squat, then your safety bar and your high bar squat, and then your low bar squat. So, one thing that you also want to look at, we're going to run out of time in a second. One thing that you also want to look at is if you are low bar squatting, while you're squatting, is the bar rolling up your back? You really want to make sure that you're securing the bar on your back and it's not rolling, because if it's rolling up your back, it's going to be shifting your it's going to be everybody who's watching this on YouTube. If we get this on YouTube, our timer just went off. So if your bar is shifting up on your back, your torso and therefore your hip and your knee angle are going to slightly adjust to accommodate your balance, which is going to be the bar over the middle of the foot. So I think that oftentimes people forget to address what's happening with the bar, and how that affects your torso angle and then your hip and your knee angle. So that's, if you have knee pain in the squat, let's not neglect what the bar is doing on your back. And I think that, when we talk about the hip in future episodes, I know that we're going to be talking about the hip. We see that a lot of times when there's an issue going on in the shoulder, and that's affecting how the bar maintains its position throughout the lift, especially the squat, we tend to see like hip and adductor issues also. So let's not neglect the bar position either. So if you are experiencing knee pain, check your torso, check your bar position. If you are a high bar squatter, if you're front squatting regularly, choose a different bar position that allows your torso to be more horizontal, which will shift the load to your hips and reduce the angle at the knee.
And I know that we're out of time, but something there is one thing that we have to touch on, and actually maybe we should have done this in reverse.
Mm-hmm.
Stance, foot placement,
Mm-hmm.
and where you're directing or guiding your knees
Mm-hmm.
as you're squatting. So a lot of these things are hard to correct if the stance is too wide.
Mm-hmm.
Um, and that's when we see a more of a valgus knee angle, which makes it difficult. So if your stance is wide, it makes it harder to externally rotate your hips enough to keep your knees tracking in line with your toes, and
And
it
I
can
think,
become
yeah.
challenging to make these other changes.
Yeah, and I also think, we really only spent the 10 minutes talking about central anterior knee pain. But when you have lateral or medial knee pain, we should be looking from the frontal view, the front view or the back view, and saying, is there excessive knee out at some point in the lift, or is there excessive knee cave at some point in the lift? Because I think that people take the knees out cue a little bit too far, and they end up pushing their knees out past their pinky toes, basically. So they go outside of the realm of their foot
Hmm.
with their knees, and that can put extra pressure, extra stress on the lateral aspect of the knee. And then if you are not thinking of knees out and your knees are caving in, or you're using loads that are too heavy that don't allow you to get your knees out or track um, in midline with your feet, then you're getting excessive knee cave. And over time, that pressure on the medial aspect of the joint can cause irritation to the medial knee joint line, or like the meniscus. And we're not pinpointing any we have to be really careful. We're not pinpointing any structure specifically that's hurt. We're just kind of talking about locations, but what's in that location is like joint line pain tends to be could be indicative of a meniscus issue, but it's not. That's not the issue. The issue is that we're loading that in a way that it's not happy about. And then also that excessive knee cave puts pressure on the medial collateral ligament and the aponeurosis and the joint capsule and the tendons in that area, and it can just be very irritating if it's constantly happening over time and you're not allowing yourself to recover. So when we're talking about knees out, so when we're looking at uh, excessive knee out or excessive knee cave repetitively and more aggressively over time, it gets worse and worse over time. One thing that we want to do is lower the load to a point where that's not happening and rebuild from there. But we've got to think of maintaining our knees or our thighs in line with our feet, not too far out and not too far in. And we can do this with our brains first and foremost, and lowering the load using tempo and pause to really think and execute. But then if we're struggling with any of these changes, not going too far forward and not getting too much knee out or knee cave, we can take a foam roller. This is like one of my favorite things to do when people are really still struggling with kind of the awareness of where their knee is in space. We can put foam rollers very close to the feet to a point where we don't want the knee to go past. And it's a very obvious error, so to speak, if you knock the foam rollers over, right? So I don't really default to that anymore. I think I used to default to that much more in the past when I wouldn't make load changes as regularly as I do now, where I really use load and tempo to make these adjustments. But maybe like once or twice a year, if someone's really struggling with this, I might use the foam roller to. And I would say that it's easier on the brain to do it on both sides, because you might shift a little bit unintentionally if you have it just on one side. So if you can grab yourself two foam rollers to help you with this, that would be a more ideal scenario, but you don't need to do it. If you can achieve it on one side, you're probably achieving it on the other side as well. I would just definitely film yourself to make sure that um, you're not shifting. So we are well over our 10 minutes. We are a little rusty as recording. We put a lot of pressure.
What's
Pressure on
10 minutes anyway,
What's 10 minutes? We put a lot of pressure on ourselves to start our recording with a timed recording here. So anyway, that is 10-minute tip Tuesday. We are talking about modifying the squat for knee pain, specifically anterior and medial lateral knee pain. This is not addressing posterior knee pain, although it might, like you might be experiencing posterior knee pain that can be addressed with some of these technical issues or corrections. But again, pain is a complex experience. It's multifactorial. It is not just technique. It is not just load. It is not just the structures of the knee being damaged. And it is not all in your head. So go ahead and listen to our pain and injury series, part 1, 2, and 3. We'll link those in the show notes for you. And if you have any questions, if you need help with technique, you can join us in the Secret Society of Barbell Mastery, where we do form checks every Wednesday and Friday. You can post videos in there for form checks and help with your technique. And if you need help with your program or addressing a pain or injury that you're experiencing in training, or you want private help with your technique and don't want to do it in the Secret Society of Barbell Mastery, you can also book a free consultation with Alyssa, myself, or any one of the members on the PRS clinical coaching team. So we'll link that in the show notes as well. And we'll see you next time, guys. Bye for now.